Hi, welcome to webcast series episode number 1, Influenza and COVID-19. I just want to make a disclaimer before we get started that the information contained herein is not supposed to be for medical advice or any kind of medical treatment. If you have signs and symptoms of influenza and or COVID-19, please see your personal care provider. So here's our objectives for today. We are going to do just a general brief overview. It's not going to take very long of both influenza and COVID-19. We're going to look at some history, the transmission, symptoms of both, and then look at diagnostic testing. How we're going to end the webinar today is looking at important public health and personal strategies to mitigate the risk of both flu and COVID-19. We'll also specifically look on businesses and what they can do in general type of plans and as a whole to help keep their employees safe during these difficult times. So a little bit about me. I'm Dr. Scarlett Spain. I'm an assistant professor at Valparaiso University in the College of Nursing and Health Professions. I'm also an occupational health nurse practitioner. I've been practicing occupational medicine for a little over 10 years now, and I'm a consultant here at MedX. At MedX, we are passionate about helping businesses out during these difficult and trying times with COVID-19. So we are placing talent and also kind of helping to devise interventions to help businesses to continue to run as smoothly as possible, and first and foremost, to keep their employees safe. So before we get started, I do want to talk briefly about epidemiology and what exactly that is. So this is a term that's used in public health often. So it is technically, or the definition is the study and analysis of disease and other health outcomes. So epidemiology examines the causes of disease or poor health outcomes in a population, and then it looks for ways to control and identify the source of the disease or poor health outcome. So with epidemiology, it can be used to assess population health, also to make decisions that are affecting health, and search for causes. It also monitors and tracks disease. It studies diseases. And then from there, guidelines or guidance can be developed for actions to slow the spread of disease and lessen its impact. So epidemiology, again, is very broad. It can be looking at infectious disease, which is what we're going to do today. It can also look at chronic diseases as well. So some basic science facts with influenza. This is a contagious respiratory viral illness. So there is 4 different types of influenza: A, B, C, and D. When we think of influenza, we often think of A and B. And the reason we think of A and B is because these are the common types that cause our yearly flu season. So these are the 2 main types that come around yearly and cause the burden of flu. With flu, there may be varying symptoms. It's kind of a spectrum. So there's a wide range from very mild illness to severe illness, serious complications, and death even in some cases, unfortunately. So I do want to talk briefly about the Spanish flu of 1918. This is a relevant topic right now just because of kind of where we are at in life. So the Spanish flu of 1918 was a widespread global pandemic. It was an H1N1 virus of avian origin, and the approximations were that 500 million people, or 1/3 of the world's population, were infected, and it ended up causing a estimated 50 million deaths worldwide. So the Spanish flu was actually, it was a very virulent form of influenza. It actually killed otherwise healthy middle-aged adults. And also with the Spanish flu, there obviously were not flu vaccinations back in 1918. And although viral, sometimes with severe influenza, pneumonia can be an issue, and secondary pneumonia of a bacterial origin can also be an issue. At this time, there was not antibiotics that were in use at that time for the potential secondary bacterial pneumonia. So this influenza milestones, again, I think this is a good graphic that just kind of shows where we've been at in the past 100 years. So this is directly from the CDC. So you'll see it starts in 1917. So this is when we entered World War I in the United States. The life expectancy at that time was 54 for males and, I'm sorry, 54 for females and 48 for men. By 1918, that's spring and fall waves of influenza. That activity actually decreased the average life expectancy by 12 years. So that's a huge, huge decrease in the average life expectancy. In 1919, the third wave of the pandemic began. Flu activity was still occurring. So it did start to subside, but the virus continued to circulate seasonally for 30 years. And then in 1930, the first isolation of influenza, proving that flu is caused by a virus, not a bacteria. And in 1957, H2N2 flu virus emerged to trigger a pandemic, replacing the 1918 H1N1 pandemic virus. 1960, the U.S. Public Health Services was the first time that they recommended an annual flu shot or flu vaccination for people at high risk of serious flu complications. And then in 1968, there was another flu virus that emerged that triggered another pandemic that replaced the previous pandemic. In 2005, the genome of the 1918 pandemic flu virus was fully sequenced. And then in 2009, H1N1 viruses distantly related to the 1918 virus emerged to trigger a pandemic. So transmission of the flu. Flu is transmitted via droplet transmission. The incubation period, or the period from time of exposure to the illness to getting the illness or being symptomatic with the illness, is symptoms usually begin between 1 and 4 days after exposure. And then the period of transmission, so this is when somebody can actively transmit the illness to somebody else, is going to be, it's probably about 1 day before symptoms develop and up to 7 days after becoming sick with influenza. So symptoms of the flu, again, remember that this is a spectrum. So it's usually sudden onset of symptoms, which may include fever, chills, cough, sore throat, runny nose, headache, fatigue, vomiting, and diarrhea. Of course, may be mild to severe. So flu and complications, this is directly from the CDC. I just wanted to show you these to show the burden this disease can cause. So when I talk about burden of disease, or when we talk about it in public health, it's not only looking at prevalence of the disease and then case fatality rates, it's also looking at all the associated factors with somebody being sick with whatever illness you would be looking at. So it could be financial issues, it could be family issues. There's a lot of things that go with being sick. We are hearing that more and more with COVID now, where people, even though they are technically, free of COVID, they're still having those lingering effects. So from October 1st, 2019 to April 4th, 2020, there was an estimated 39 million to 56 million flu illnesses. Again, this is just looking at the United States. And then there was 410,000 to 740,000 flu hospitalizations and 24,000 to 62,000 flu deaths in that time. So now let's go ahead and start to look at COVID-19. So COVID-19 is a contagious virus caused by a new coronavirus that has spread throughout the world. So again, can cause mild to severe illness as well. With COVID-19, we do see even asymptomatic cases, so people who have no signs and symptoms of the illness whatsoever. So history of COVID-19. COVID-19 is caused by a novel coronavirus, so a new coronavirus that was first identified in Wuhan, China in late 2019. There's theories on where this came from, but the origin and source still remain unknown at this time. So this was declared an epidemic in mainland China in February of 2020, and then it was declared a pandemic by the World Health Organization in March of 2020. So transmission of COVID-19. It is transmitted via droplet. However, there's lots of studies that show that it is possibly likely also transmitted via airborne transmission. So the incubation period with COVID-19, again, remember this is going to be period of time that passes after an exposure to when symptoms start to show. So most common is going to be 5 days, but it can vary anywhere from 2 to 14 days. So symptoms of COVID-19. Again, as I mentioned on 2 slides ago, people could definitely be asymptomatic where they have no symptoms. And we do know also, it's important to point out that older people and then people with certain underlying medical conditions may be more at risk for developing serious complications and or death. With that being said, there has been deaths reported in, otherwise healthy middle-aged individuals as well. So the signs and symptoms, again, are fever, cough, shortness of breath, difficulty breathing, muscle aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea and or fatigue. So again, just kind of a little snapshot of where we are at. And this is actually a bit dated, so these numbers are not correct as of today. So this is from October 27th. As of October 27th, and again, just examining the United States, there was total cases over 8.5 million. Cases in the last 7 days from that calendar time was 500,000. And then total deaths was 225,000. Again, unfortunately, these numbers are much higher now. So diagnosis of flu versus COVID-19, as you can see, and as we discussed, they have a lot of similar symptoms. So it's really difficult to make that definitive diagnosis without testing. It's actually near impossible. So to get that definitive diagnosis of whether it's flu or COVID-19, testing would need to be done. There is testing available for both influenza and COVID-19. So when to get tested for COVID-19? So people showing symptoms of COVID-19, also people who've had a known exposure to somebody who is positive for COVID-19, and then people advised to get tested by their healthcare provider, their local or state health departments. So I wanted to just include this slide because it's got some good information. And it looks at contact tracing and then also return to work. On the CDC side, it's actually, they have it labeled as maybe around others. So let's start with contact tracing. So contact tracing is a public health strategy that's been used for quite a while, many, many years, that looks to identify a person who has a illness and then identify the contacts that were around them. So the whole point of contact tracing is to stop or mitigate the spread of infectious disease. And how this is done, again, by identifying a person who is known to be positive for COVID-19. Somebody, the contact tracer would call them and let them know that they were indeed positive for COVID-19. And then from there, ask who their exposures have been. So they will find out who those exposures were, and then they make a phone call. It's important that the contact tracers do, of course, abide by privacy, so they can't disclose who the person was exposed to, but they would make a phone call and let the contact know that they were indeed exposed to somebody who tested positive for COVID-19. From there, the contact tracer would ask about if they've had any signs and symptoms of COVID-19. They would discuss a quarantine period, and then also, discuss if they needed to follow up with their healthcare provider. These conversations, although they do technically follow a script with contact tracing, they are all going to be individualized to a certain extent, dependent on the case. And then also this last part, again, this is going to be maybe around others, or if you are watching and you're part of a business, it's a return to work. Again, I cannot advise or direct on when somebody is safe to return to work. This is directly from the CDC. So they say that others can be around, people with COVID-19 can be around others when it's been 10 days since symptoms first appeared, and 24 hours with no fever, without the use of fever-reducing medications, and other symptoms of COVID-19 are improving. So there's an asterisk there on that bottom bullet point, and I have the source here at the bottom. Again, it's from the CDC. So again, if you're looking to develop your plan for your workplace, please feel free to follow this link and kind of guide yourself around the CDC site, and they've got a lot of great information. So when to seek, this next slide again is straight from the CDC, and it's when to seek medical attention. So remember that this is not meant to provide any kind of medical advice, and this is not an all-inclusive list. So this does not show all the possible symptoms. The symptoms that the CDC does have listed is trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. So this slide is protecting yourself and others from COVID-19. So it's really important to physically distance ourselves. We've been hearing the term social distance. It's actually physically distance. We want to stay away from others as much as possible. Again, we're trying to reduce that risk of transmission. Also using a mask or a face covering. Washing your hands frequently and thoroughly. Stay home and isolate when sick. So this is a little bit different than what a lot of people have done for many, many years. And this is actually going to require a change in health communication. So again, lots of people, even if they were sick, they would still go to work just because they felt obligated to, or they would work through it. We really need to change the health communication so that people know if they feel sick, do not come to work, because we do not want to transmit this. We do not want to transmit COVID-19 to others. And then routinely clean and disinfect frequently touched surfaces. Get rest and good sleep. So this is important to keep our immune system good without being sick. And it's really important, again, after you've been, the body will help to heal itself. And then eating a healthy diet, of course, is important. Supporting coping and resilience. So this year has been really tough on people, whether they've been directly impacted by COVID-19 or not. There's been so many changes, so many stressors that lots of people are really, really struggling. So if you're watching this webinar and you are a business owner, or watching, if you're part of HR or watching for your employees, I cannot urge you enough to make sure that you've got something in place for your employees, somebody to talk to when they're feeling stressed or overwhelmed, or just some kind of guidelines that you can give them to share with them. If you're watching this just for yourself and you're feeling stressed or overwhelmed, I urge you to seek out help as well. And then last but not least, get annual flu vaccine. It's really important every year to get our flu vaccine. This year, it's of extreme importance as long as there's no contraindications to obtaining one. So the flu vaccine is going to be really important this year. We've seen surges throughout the country since COVID, since spring, and we continue to see surges. So right now, certain areas of the country are at capacity in their hospital system. So we need to try to prevent other illnesses as much as possible. And then guidance for businesses and employers. So it's important for businesses to conduct daily health checks. So every business that's doing this, it may look a little unique, but it's kind of following the same guidelines. So a daily health check may consist of a questionnaire, and the questionnaire may have questions such as, do you have any signs and symptoms of COVID-19? Have you been exposed to anybody who tested positive for COVID-19? And then temperature checks or something along those lines. And then also conducting a hazard assessment of the workplace. Again, encouraging employees to wear those cloth face coverings in the workplace. Implementing policies and practices for social distancing in the workplace. Improving building ventilation systems. And again, really encouraging sick employees or those who have been exposed to COVID-19 to stay at home. So my next two slides are actually just my references, and there's a wealth of knowledge on there through those references. Again, the CDC is cited on there multiple times. The CDC has so much information. If you are looking to develop your plan, I highly urge you to take a look at that and see what you can find. And then also I want to talk real quick about MedX and what we can do as well. So we have successfully placed contact tracers, talent to do COVID testing, temperature takers, and then we've also been helping out businesses and workplaces with questions and kind of consultation things and ideas for keeping people safe while at work. So if you want to reach out, I would be more than happy to talk with you about what we can do. You can find me on LinkedIn, or feel free to email me at scarlett.spain@medixteam.com. And that was actually listed on my bio page as well. So please feel free to reach out. I would love to talk to you and see how we can assist your business further. So thank you so much. Bye.